Well, hi guys, welcome to my channel, Roxy Winnie L. I know it's been a long time and you're probably wondering why I got blue gloves on and this white protective gear, this yellow protective gear. Well, my mom's in a hospital and it's been actually 7 months since she hasn't walked. And I had all medical equipment at home, including a hospital bed, and her legs were swollen. And the doctor said that she couldn't walk because of her last hip surgery, and they became so swollen that the liquid was coming out of her legs. And then an infection set in because of urinary tract infection. She kept having fever, and she was really weak. And the 31st of December, I spent it at the emergency room with my mom, and under her foot, her right foot, the heel of her foot was all black. It was dead skin. You know, when somebody gets frostbite, and it was the circumference of a grapefruit. And so the surgeon had scratched and cleaned it all out, and it left such a big wound exposed, even the bone. I'm telling you, it was really, really disgusting. So after, with many different kind of treatments, they actually put a vac under her foot to pull away all the pus and the bad stuff to make her heal quicker. But my mom is diabetic and she has high blood pressure, and many other problems. And that's why, guys, I haven't been on here making videos on YouTube. So I'm really sorry. I mean, important stuff like this, uh, I can't just push back and leave it behind. Um, I'm not doing well also, because I'm doing everything for my mom. I'm trying to make her feel good, and her morale is not doing so well. And she wanted to come home, and she did for about a week. But that week that she was home, I couldn't take care of her at all. I had a hard time changing her and cleaning her, and she was actually getting fever. And they told me if she would go home, she would maybe probably start another infection. And I think that she did. Now she caught another infection here at the hospital, which on the second floor here, the Unity, on the east side wing of the hospital, they're all put in a special corridor. And this infection, it's called the ERV. In French, it's ERV. And you catch this infection primarily in a hospital. But she's not the only one. And the sad news is because she had problems with her foot under her heel, uh, it actually took, I think, 2 months, which after an operation that she got, if she wasn't diabetic, she was going to heal quicker and she was going to get out of the hospital. But because diabetic patients and people that have diabetes, like myself, it takes longer to heal quicker. Okay. So now the bad news is that through information and talking it over with my mother and making her understand, and the doctors too, that the best thing is to amputate. And honestly, till this day, it bothers me so much that we've come to this point. She's come to this point, and it looks like she's just getting worse. But I'm gonna be there boosting her morale because it's not easy, and a patient or patients don't accept well when somebody tells you that you're going to be amputated and a piece of your body is going to be removed. I know that she's going to have her health, and there's wheelchairs and there's prosthetics, but to lose a part of your body, I mean, you came into this world full form, and now the only option is amputation. So, um, Like I said, I've been in the hospital in and out. And that's hard for me as well. And on another note, I've, in the past, when my dad had passed away in 2013, the year after, for some reason, I had coughed so much that I had fainted. And I was good where I was because I didn't remember where I was. But what woke me up was my mother screaming my name. And that's the first time it happened. Now, the second time it happened, I was all by myself at home. But due to this coughing, it's because I never wanted to tell you guys, but I'm a very heavy smoker. Sorry if I offend anybody that don't like smokers, but I respect that. And it's my choice. But I've come to terms now that I think I have to quit slowly and quit because as soon as I find something funny and I laugh, I cough. And I cough so much that air doesn't come in and I'm literally choking. And when that happens, I lose consciousness. And when it happened, I was sitting on my lazy boy at home. I coughed so much that I hit the floor so hard with my teeth and my face that when I woke up, I looked at the floor and I said, "What the fuck am I doing here on the floor?" Because I didn't know where I was. I didn't know how long I was off for. And then when I pulled up my head off on the floor, I started pissing blood from my lips. Both my lips, my teeth are still in pain. I haven't gone seen a dentist yet, but the pain is actually reducing by itself. I went to the emergency room, gave me medication to calm down the pain. I got no stitches done, but you could see my lip is pretty, it was much worse than this. It was pretty puffy, but things are not looking good. And on top of all that, we're moving. We actually sold our house, so my mom is actually happy. We're all happy that we're moving, and now we're just um, trying to rush finding a home because the people that were interested in our home already bought it and legalized it with all the documentation. So we have about maybe a month left to pack up and move. So it's urgent. It's quick. It has to be done super quick, and it has to be a home where it facilitates my mom's in and out, and that could easily be accessible for my mom, knowing that now she's going to be amputated. So, of course, I'm going to be having a wheelchair at home. Um, it's all going to be a life changing experience for my mom as well as for myself. And that's about it. I mean, right now there's just so much to think about, and so much has happened since the 31st of December of 2016 that coming into 2017, I thought things were going to get better, and it's not. So I hope we could get out of all this bad negativity that's maybe circling us and that's around us. And I just want things to be better for myself, for my mom, and for everybody that's around us. That's all I'm hoping for. So that's why I've been out of the spotlight. And I know that it's hard because when you devote yourself to making videos, and I know that has to be constant, and but you got to understand that sometimes making a video like this and pouring out your feelings, you're actually maybe um, talking to somebody. Maybe somebody could help me, within the comments, and that's why people do these videos. So by doing videos in this kind of sense, it's very educational. You see what people go through in a day, in a year, and so I still look at a lot of YouTube videos, but have no time to really comment. I just I go through, and I continue on with my day, and I try to make the best of it. So, but for myself, I know I got to stop smoking and maybe lose a bit of weight, a lot of weight, and that's about it. So, on that note, I'm just gonna show you my mom quick. She's very tired. So, and I told the nurses because she's getting operated tomorrow. I actually came in tonight at the hospital, and they told me to that I wasn't allowed coming here because I actually came late. I came around 10:30, and there's no visits at that time. But I told them that my mom wanted me to sleep here tonight because she's scared for tomorrow. So they understood. They were compassionate. So they prepared me this little bed here. You could see a little pillow, and it's not that comfortable, but it's better than nothing. And she's really nervous. And I made her eat something because my mom doesn't eat at all, and the doctors told her that she needs to eat at least a bit of protein, and she needs to eat well because she's not been eating well, and for her condition, it's serious. So she actually sleeps with the TV, so I purchased her television. So, Ma, you want to say something?
To who?
Well, to the YouTube, to the
Oh,
viewers.
hi, YouTube. How are you?
How you feeling, Ma?
Me?
Yeah,
Good, but anxious for tomorrow.
yeah.
I don't know what's gonna go on.
Mm. You nervous?
Yes, I'm gonna be very nervous. I don't know how much I can take this.
Don't worry, it's gonna be okay.
Mm. But it's me going on through this.
I know.
Well, I'd rather be me than my kids.
Mm.
But
Okay.
I'm telling you that I love you.
I love you
If
too.
something should
No,
go
stop
wrong,
saying that, man. Don't say stuff like that. It's like you're planning on leaving. Don't you should fight
no,
against it.
no, not.
No, don't talk like that, man. It's not nice. You're gonna be okay. Everything is gonna be fine. Your TV, man. You're gonna watch it.
Yes,
Mm.
I wasn't all night. The morning it's open because
Mm. So that's it, ma. Say bye to the viewers and the people that
by
subscribed and watch us,
viewers, by viewers, thanks for coming or thanks for viewing me.
and
I
pray for
love
me
you.
and pray for me.
Pray for me that everything goes well. And God bless you all.
Mm. Okay.
God bless you.
So that's about it, guys. You heard my mom. She was tired, but at least she put in a couple of her words. So, on that note, I leave you. Like my mom said, God bless you all, and hope to do another video soon. Take care. Have a nice night.